So excessive carbs will raise your triglycerides. Now, we don't hear much about triglycerides. We hear about cholesterol all the time. What are triglycerides? Well, they're also known as VLDL, or very low density lipoprotein. They don't call it, you don't hear that name, but this is actually the bad LDL. We've heard of bad cholesterol and good cholesterol, right? They've actually started to fractionate the bad cholesterol now and the good cholesterol, and they've discovered that the bad LDL is actually the stuff called VLDL. So basically, if you eat a high-carb diet, you're actually raising, to a certain degree, your bad cholesterol. And the fructose is the worst sugar for raising VLDL and triglycerides. I mentioned this before. Fructose, it's preferentially taken up in the liver. It's poorly utilized by the rest of the body. You cannot use it to make energy. You can't burn it in exercise. It's unable to be directly burned as energy. It must first be stored as fat, then burned as energy, and it raises triglycerides. It also lowers the HDL, and I'm going to show you some studies on that. So excessive carbs, not only will it raise your VLDL, it'll also increase your insulin levels. Now, how does that happen? Well, if your blood sugar goes up, now your body's trying to lower your blood sugar. How does it lower blood sugar? By raising insulin. Now, is that a good thing? No. Well, no. Insulin is actually not too much of insulin is actually very bad. Now, let's look at the flip side of this. So the government's saying, okay, eat lots of carbs, but keep that saturated fat and cholesterol down because it's a poison. Well, actually, if you lower saturated fat, you will actually lower levels of HDL, the good cholesterol. Well, this comes from the American Journal of Clinical Nutrition. Effective low-fat diets on high-density lipoprotein concentrations, and here's the highlight here. In controlled trials, plural. Low-fat, high-carb diets decrease HDL concentrations, and the effect is strongest when carbohydrates replace saturated fatty acids. So you can see I'm not making this up. This actually comes right from the medical literature. Okay? Over and over again, when you do these studies, low-fat diets, especially low in saturated fat, will lower your HDL, the good cholesterol levels. So what is cholesterol? Well, do we need this? What does it do? What is the purpose? Is it there just to clog our arteries? Does it serve other purposes besides causing heart disease? In fact, it does have other purposes, and this is a biosynthetic pathway, and it shows that cholesterol is the precursor for all your hormones, at least your sex hormones and your adrenal hormones, okay? So things like pregnenolone, progesterone, corticosterone, cortisol, testosterone, estradiol, estrone, androstenedione, etc. All of them come from initially from cholesterol. So obviously we need some cholesterol in our diet. Zero can't be good for us. And the question is, well, what happens if you have too little? Low intake of saturated fat and cholesterol actually will lower your sex hormone levels. Where's the proof? Right here. And there's plenty of these studies, but here's one. Decrease of serum total and free testosterone during a low-fat, high-fiber diet. Here's the highlight. When men were transferred from their customary diet to an experimental diet which contained less fat with a higher polyunsaturated-saturated ratio and more fiber, there was a significant decrease in serum total testosterone concentrations. So when you lower this and increase this, you actually lower your sex hormones, which would make sense if you understand the biochemistry. It's right there, right in the biochemistry of cholesterol. Here's another study showing the same thing. Diet and serum hormones in healthy men. A decrease in dietary fat content and an increase in the degree of unsaturated fatty acids reduces the serum concentrations of androstenedione, testosterone, and free testosterone. Have you guys heard this before? Surprise you?
Yeah.
Yeah. Interesting. So we actually certainly need some cholesterol and some saturated fat, and the question is, well, how much? And we will get into that in a bit. Low total cholesterol is associated with a high total mortality in patients with coronary heart disease. What? Is that a misprint? This was a study. They were trying to look at this drug called benzofibrate, and they looked at, it was like a lot of patients, more than 10,000, almost 12,000 patients, and some of them were actually not candidates for the study because their cholesterol was too low. They wanted people with high cholesterol to put in the study, and so they had to exclude all these people, 10,968 people, and they looked at them and to see what their cholesterol level was, and guess what? The relative risk of non-cardiac death was 2.27 times higher in the low cholesterol group than in the controls. So people that had cholesterol less than, I'm not sure what the cutoff was there. I'm sorry, I don't know the cutoff, but whatever that was, they had higher levels of death, more than double the death rate. Here's a study looking at high-density versus low-density lipoprotein as a risk factor for coronary artery disease and stroke in old age. This is from the Archives of Internal Medicine 2003. Conclusion, in contrast to high LDL cholesterol level, low HDL level is a risk factor. So they're saying that actually high LDL is not a risk factor. It's the low HDL, which is a risk factor for mortality from coronary artery disease and stroke in old age. Another one is talking about HDL being an independent risk factor. This comes from the famous Framingham study. For every 1% increase in the HDL, there was a 3% reduction in death from heart attack, a therapeutic benefit that eclipses the benefit associated with LDL reduction. It's really, really important to have high HDL. Having low LDL is not that important. All the literature says this. How do we raise HDL? Well, the literature says eat saturated fat. This is another study with older people, the Honolulu Heart Program. Conclusion here, these data cast doubt on the scientific justification for lowering cholesterol to the very low concentrations in elderly people. This, I believe, is less than 160. So there's a lot of information. In older people, low cholesterol levels are actually not healthy. There's so much data on this that once you go past 65, when your cholesterol level starts to drop, the mortality rate goes way up. This does not apply to younger people. Okay? It only applies to older people. And you may ask, well, why is that, Doc? Okay? And I'm going to explain that to you in part 2. Again, very old people, total cholesterol, what do they say? In people older than 85 years, high total cholesterol level concentrations are associated with longevity, owing to lower mortality from cancer and infection. This comes from The Lancet. Now I'm quoting very prominent medical journals. Okay, these are very, very mainstream journals. Well read, well received. This is one of the biggest journals in England.